you face and you run into tragedy head forward because you know that you have the opportunity to help. You also know when to hit the pause button and go, I just need to hold somebody's hand. I just need to give their family a hug. I just need to ask for a little bit of help. All with strength, care. And then as you walk out of the room, you lose it and you cry. And you go home and you try to talk to your family about what you do on a daily basis, but it's hard. I am Shannon Conley and I'm a recruiter for Atlas MedStaff. The reason that I'm sitting here today and am passionate about Nurses Week and nurses in general and all that you do goes way back, actually 20 years. I started my career actually interested in healthcare and decided to work my way through college as a phlebotomist. I gained my phlebotomy certificate in Colorado, where I started to work as a phlebotomist in a level 1 trauma hospital at St. Anthony Central. 20 years ago, actually, probably about a week ago here, was Columbine. I was working in the emergency room that day. I was actually getting ready to get off shift and walked in from coming off of breaks, and there was a little TV. And all I could see was SWAT teams and Columbine High School and them talking about pipe bombs. So I rushed back to the lab and said, hey, something's going on. Blood bank, are you ready? And then all of a sudden the T10 bells went off. The team that was working that day was incredible. And it changed my life. As a nurse, you guys are faced with tragedy. You're faced with having to organize everything and make sure that everybody is doing exactly what they need to do at the time they need to do it. Take directions from the doctor and at the same time care for the patients. And on that day, I watched this incredible team come together. And the nurse is saying, hey, can you hold their hand for a little bit? Here, we need you to do this next. Can you do this? Can you do this? The passion and the care and the concern that they show while also ensuring that they're taking care of the patients is just, it's incredible. The next morning when I went up to the ICU and had the opportunity to see the patients again, the parents were sitting in the room and they asked, did you see my child when they walked in yesterday? Did you help them? I didn't have kids at the time. And as a healthcare worker, you have to hold it together at that moment. And you say yes. And they say, thank you. Thank you for saving my child. And that's what nurses do every day. You know every time that you put your scrubs on, that you put your ugly dance goes on, and you put that stethoscope around your neck, you know what you're walking into. You know what you're facing, you're armed, you're ready, and you want to take care of them. That's why I'm passionate about what I do. It formed who I am today. So when I had the opportunity to do something that I'm passionate about, give back to the people that shaped my life, that was an incredible opportunity and experience. And that was with Atlas MedStaff. How that carries through to what I do every day is here's the deal. I know what you guys are running into. And as a travel nurse, it's even heightened because you're walking into a facility. You're traveling away from your families. I have the opportunity to be of service to you. I'm there to pick up the phone. I'm there for you at every moment because I know what you're facing on a daily basis. And when you have a bad day and something has gone wrong, you can pick up the phone and you know that you have somebody who understands what you're facing.